Hey there, Dr. Norris Golberg, owner of Koru Chiropractic, and here's 5 mobility drills, stretches, and exercises to help your shoulder health and prevent pain, or maybe even help with some of the pain that you're experiencing. So what I find to be the problem for most people with shoulder pain, they may have experienced like a trauma, a dislocation, or some sort of injury to the shoulder, but a lot of people I'm finding have actually never really experienced trauma, but they have really bad posture. They have upper cross syndrome, so there's a couple muscles that we actually need to focus on surrounding the shoulders here to actually help with the pain that you're getting in the shoulder. So first, we're gonna stretch pec major, that big muscle right here in your chest. We gotta get that loosened because usually it's too tight and it kind of rolls your fist or your hands forward like this. So you're gonna find a door frame or a corner just like this. You're gonna put your hand at a 90-degree angle, or I should say your elbow at a 90-degree angle, and then step forward with the opposite foot and get that nice deep stretch by leaning your body into it. You're gonna feel a stretch all across the front. Okay, so an additional stretch that's very similar is to stretch pec minor. Pec minor goes from about here into the shoulder. It kind of feels painful in the armpit if it's really tight. A lot of people miss this stretch. Same thing, you're gonna set it up, but now what you're gonna do is set your elbow up at 45 degrees, step in with the opposite foot and get that nice deep stretch. So do both those stretches, 30 seconds per side, and repeat as necessary. If you're really tight in the chest, you should be doing that 2 or 3 times in a row. So the next stretch we're gonna do is stretching out your lats, right? Latissimus dorsi is the full name. It's this muscle that kind of attaches to the back of your armpit here. It really goes up all the way into the shoulder. Again, if it's too tight, if you have upper cross syndrome and forward head posture, it's actually holding your shoulder down and gonna create a lot of tension and pain through this area here. So let me show you the stretch. So what you wanna do is find a door frame, step about arm width length, maybe a little further away from the frame. You'll squat down, then lean forward, grab the frame, and then really actually kind of reposition your feet so you're sinking back, you're leaning back. I'm almost touching the wall here behind me, but I'm actually really feeling my full body weight stretch all the way through here, through my arm, down my lat. I can actually feel this all the way to my hip right here. And if you kind of wiggle the tail, a little wiggle waggle the tail here, you're gonna feel a nice deep stretch through that area. Just like the pec stretch, 30 seconds each side, probably 2 or 3 times in a row. Repeat as needed. Next, the third exercise that we're gonna do is actually more of an activation. We're gonna focus on the weak muscles in your mid back that are allowing your shoulders to fall forward like this. So the muscle group is gonna be the rhomboids right here. And what we're gonna be doing for the exercise is called hit the road jack. And so what you're essentially gonna do, just like your thumbs are up and you're telling someone to get out of here, you're gonna turn your thumbs down and backwards with a TheraBand for some resistance. So, I get a pack of these, you can get them at Walmart. If you don't have any of these, probably 10 bucks, you get a 3-pack, they're all different strengths. I don't need a lot of resistance for this one. Form and posture are the most important parts here, okay? So it's not about taking a ton of strength and, doing this. What you wanna do, thumbs down, shoulders down, right? Don't let them ride up into your ears, shoulders down, and then turn the thumbs back and out like this, back and out. Now check my back here and see where the contraction is. Back and out. Again, don't let your shoulders ride up. This is not the right way to do it. All right, number 4 is a mobility exercise, but it's kind of like a test as well. Some people with a lot of shoulder pain might not be able to do this. They might feel really weak, so it's a great one to start small and start doing it more and more and get better at this exercise. It's, again, like a test that you can see how good you get at it and how well you're performing at it. And if you don't have shoulder pain, it's a great way to keep your joints healthy. So it's called shoulder controlled articular rotation, or just shoulder CAR for short. All right, to set up for the shoulder CARs, you need to get your body essentially right against the wall here, maybe a little bit more room here. You're gonna take this little foam roller, about 18 inches is perfect. You could do a yoga block as well. This is a little PVC roller. You wanna get your knee and your hip here at 90 degrees. Push your leg against the wall. What that does is just sort of engages your body and your core. Then you're gonna take your hand, you're gonna reach it out. So my thumb is facing down the wall here, my arm is outreached, my core is engaged because my knee is pressing into the wall. And then what I do is I go start at 9 o'clock here on the clock, and then I'm gonna rotate my arm all the way around. I'm really trying to keep my body quiet. I'm not trying to be like rotating. I shouldn't have to look backwards. In fact, it should be nice and smooth like this with me looking forward the whole time. I'll end up with my thumb facing upwards. At this point, I'm feeling a pretty good stretch through my arm and through my shoulder, and then I'm gonna come back. So that's one. And if you can do one, that's great. But then eventually I want you to be doing really 10 to 12 on each side. All right, here's number 5. They're called wall angels. Again, this is both a mobility drill, it's a strengthening exercise. You might even feel a little stretching happening here, and it can be used as a test. If you're not very good at it, you might be able to do one properly, you might not even be able to do it properly, so it's something to work towards. And if you're good at doing it, doing this regularly is a great way to keep those shoulders healthy. Okay, so what you want to do is you want to step yourself right up against the wall. Your heels, your butt, your shoulders, and your head should all be touching the wall here, right? Then you're gonna take your arms, put them up into kind of like cactus arms here. You want your head and your shoulders and your butt to remain on the wall. Don't let your hips or your shoulders come forward like that. And then the key is actually getting your hands, your fingertips included, your wrists and your elbows all against the wall at the same time, just like this. So this is the starting position. For many people, this is really difficult. You may have like an arm that doesn't want to go back all the way, or like when you touch your wrist, your elbows may come forward. That's a sign of some more advanced problems and issues that need to be worked on, and that's when I would work with a professional more on that. So once you're in the proper position here, what you're gonna be doing, it's like a snow angel. That's why we call it a wall angel. You're gonna reach all the way up. I just push my hands straight up. I don't necessarily have to like push inwards. Push them up, try to keep your elbows, your wrists, and your fingers against the wall the whole time, and then you can bring them back down. Again, my head and my shoulders are also staying against the wall at this time, and then I'm gonna go back up again. And this is challenging. You know, I could be doing this more often myself personally, so I'm feeling a little like fatigue here in some areas. I'm really having to work hard to keep my body parts against the wall. And so again, even if this is maybe painless, I would really recommend doing this regularly. And again, if you can only do one rep, start there, and then eventually just work, again, keeping your form and your technique superb, work up towards 10 to 12 reps each. And I've got a bonus for you. This exercise is very simple. It's actually focusing more on the neck muscles, but that's super important in terms of your shoulder health. Again, a lot of people are struggling with their heads falling forwards like this. So what we're gonna be doing is cervical retraction or chin tucks, and you're gonna come steps to wall like this, back up against the wall, your heels, just like a wall angel, your heels, your butt, your shoulders are against the wall. I turn my hands outward so I can get my shoulder blades nice and flat against the wall, and then press that bump in the back of your head, press that into the wall, and you'll feel like my vocal cords, they actually kind of tighten up a little bit, so my voice changes. Press in for 3 seconds, 1, 2, 3, making sure your hips and your shoulders, they're not like dancing and coming off the wall. I recommend 3-second holds for 10 reps in a row. And that's really gonna help with wall angels. If you're having trouble keeping that head against the wall, or just in general with posture, if you're always rolling forward like this or standing like that, experiencing a lot of neck and shoulder issues, that's a great one for you as well. All right guys, hopefully that helps with the health of your shoulders and the pain that you may be experiencing, whether it's throughout the day or during your sleep. And if you like the exercises, please like the video and subscribe below.